substance misuse has become a top 5 cost driver of medical claims today. And that's been growing over the past few years. So they really want to ensure that, they're able to sort of reverse that trend, reduce healthcare costs, and also ensure that their employees are in a strong place. So we really think there's a win-win with that approach of partnering with employers to reduce costs, but at the end of the day, really having an impact on our members and achieving our vision.
Welcome back to StartUp Heatlh Now, the podcast where we celebrate the entrepreneurs and innovators transforming health. I'm your host, Logan Blaster. When I first met today's guest, he was a newly minted doctorpreneur. After finishing med school, Yusuf Sherwani teamed up with a couple fellow doctors to tackle a massive, pervasive problem that they were seeing in their clinics. Day after day, they were coming upon patients struggling with addiction, whether smoking or drinking or opioids. These were people stigmatized by their addictions into fear and inaction, or they'd reached out for help and found the options unsuccessful. They thought, with today's technology and breakthroughs in addiction management, there has to be a better way. So they built Quit Genius, the world's first virtual clinic for substance use management. They combined the best digital health tools in the market with leading cognitive behavioral therapy and medication-assisted treatment. Their solution met a hungry market. Since inception, Yusuf and his team have helped more than 750,000 people manage their substance use, and with $77 million raised, they're poised to scale even further and faster. I wanted to sit down with Yusuf to hear their scale-up vision, but also to get the story behind their recent rebrand to Pelago. Yusuf explains the name change, it's derived from the word archipelago, and explains where this growing company is headed next. Stick around. So Yusuf, thank you for being here.
Thanks, Logan. Appreciate it. 2 or 3 years.
Yeah, it's been a minute. We did our initial story about Quit Genius as many as 2 years ago, kind of the pre-early COVID times, I believe. And you have grown, you have really exploded since that time. So I want to talk about your growth as a company, but also we're here to talk about your rebrand, the company's new name, and all the things that are behind it. But let's just start with the big picture of what is this company that you've built with really a focus on your health moonshot. What is this big global goal that you're after?
Sure. So, I would sort of define Pelago as really being the world's leading virtual clinic for substance use management. What that practically means is we're transforming substance use support all the way from the prevention through to treatment, focusing on the most common and prevalent addictions today. So that's tobacco use, alcohol use, opioid use disorder. We're doing it across the entire continuum of care. But the way we're doing it really is by taking these therapies that we have known to be incredibly effective for many decades, things like cognitive behavioral therapy, medication-assisted treatment, that unfortunately only 10% of people with an addiction today, with a substance use disorder today, actually get access to. And we've really tried to reinvent them for the 21st century. What would they look like if they were delivered today using a much more virtual care program approach that improves accessibility, reduces cost, but still has the same level of effectiveness that people should expect?
Why have there been such barriers to this kind of care, given the magnitude of the problem?
It's a great question. And I think that's a pretty deep question. You can look at it at different layers, from just like an overall healthcare perspective all the way to, substance use management specifically. We study this quite a bit, and I think it comes down to a few different things. First of all, we almost take sort of a 3-pillar approach, right? It comes down to a combination of access, cost, and health equity. So I'll sort of start with access. I think the first thing is that a recognition that the US is a geographically very vast space. 20% of the population is rural. Unfortunately, behavioral health and particularly substance use disorders have been a real Wild West when it comes to treatment approach. There's so many different approaches out there, despite the fact that, the best practice has been known for a very long time. So a recent study found that only about 15% of people and 15% of providers were actually following evidence-based practice for substance use disorders, which is a real sort of challenge. You add to that the demographic shift and the challenges with access from a waiting times perspective. On average, it takes 21 days to access a behavioral health provider. We've been able to reduce that down to 24 hours. Cost has also been massively prohibitive. Traditionally, substance use disorder treatment has fallen out of network, and often you have to travel in order to find an available provider, and that acts as a further barrier. And then the final piece is just effectiveness. It's, when you sort of look at those numbers around the use of evidence-based practice, and then health inequities that have become more commonplace over time, again, that contributes towards being another friction point and barrier. And within that stigma, it's not the thing that people feel most comfortable talking about. And as a result, people often don't seek treatment until things start to get really bad. But, this was much more preventable if we took, more proactive approach earlier in people's care journeys.
All right. So let's get really practical about your proactive approach. What is it that you built, and kind of where are you at in the company life cycle?
Yeah. So, I said that the way our programs are architected is really to look at what is best practice from a treatment perspective, and then what would that look like if it was reinvented today. It comes down to really sort of a 4-pillar approach. So, we are a healthcare provider ourselves in the US. So we have our own care team that consists of a nationwide network of physicians, nurse practitioners, coaches, drug and alcohol counselors, who are able to deliver support through our app, through a telehealth experience. But it goes beyond just telehealth. It includes asynchronous support in-app messaging. In conjunction with that, we have Pelago RX, which is end-to-end medication management. So we're at a point now where our physicians can not just prescribe medication for our members, but we can actually discreetly fulfill those prescriptions to people's homes or partner with the employer to integrate directly with their PBM. And it's a closed loop system. So our app then has in-app adherence tracking to see whether or not those people are actually taking the medications, and remote monitoring. And that all creates a rich feedback loop for our care team to see how members are doing over time. It goes beyond human support as well. We have this entire personalized technology and support program where in between sessions, individuals are able to interact with digital cognitive behavioral therapy content and craving tools, check in their progress. And then we gamify some of the rewards that people actually will, expect as they overcome an addiction, the money saved, the impacts you have on sleep, etc. So it's really this sort of holistic program that's built around an individual that's designed to really get them to the best place that they need and provide an engaging experience, much like people would expect from any sort of technology product today, but doing it in healthcare, which unfortunately hasn't really been known for its sort of, consumer-led approach historically. So that's the program itself. I think fundamentally the question is, how do we get people into the program? So our business model is really built on a B2B2C approach. We partner with employers and health plans today, who are actually coming at this with a very strong ROI incentive. They've seen that substance misuse has become a top 5 cost driver of medical claims today. And that's been growing over the past few years. So they really want to ensure that, they're able to sort of reverse that trend, reduce healthcare costs, and also ensure that their employees are in a strong place. So, we really think there's a win-win with that approach of partnering with employers to reduce costs, but at the end of the day, really having an impact on our members and achieving our vision.
Now, just to make sure that I'm clear, we're talking about the full gamut of substance use disorder, whether it's smoking, opioid use. What all do you cover?
Exactly. So it's the full gamut of different types of substance addictions, but also the continuum of care. So, for somebody with, who's drinking too much, that could basically be anything from binge drinking to, moderate alcohol use disorder, where they're high functioning, all the way through to severe alcohol use disorder. Now, the traditional treatment paradigm has meant that people don't feel comfortable seeking support until they really get to that sort of end stage, until it's a severe alcohol use disorder. Yeah. And what we're really trying to do is take a much more proactive approach, partnering with our enterprise clients to identify people who are at risk of getting there, preventing that. But also, if they do have a severe alcohol use disorder and opioid use disorder, then we're able to actually also treat that for the most part virtually. So typically what we find is about 90% of people with a substance misuse of some kind can actually be treated virtually, but and we're really focused on engaging them in their care. And it is everything from tobacco through to the full spectrum of alcohol use disorder to opioid use disorders. And in the future, we're looking at also adding other substances such as stimulant addictions, cannabis addictions, etc.
Gotcha. Yeah, that is a Pandora's box, isn't it? We're all addicted to something. Part of the reason why we're having this conversation is that you recently rebranded. You went through a major rebrand. Pelago is the new name. And so I want to know kind of what the journey was like, what you learned over the last couple of years that led you to the rebrand decision. A lot of the people who listen to this podcast and watch this channel are founders themselves. Many have gone through this sort of rebrand challenge. And so really some of the tactical things that you thought through could be helpful here. So what does the new name mean and why did you do this?
Yeah, it's a great question. I mean, so the tactical advice I would give founders is spend more than 5 minutes thinking about your company's name before starting. But all joking aside, like there was intentionality with the former name Quit Genius, right? And the reason was we started with a focus on tobacco cessation, which more often than not, involves quitting. You typically don't want to reduce the number of cigarettes because of the nature of a nicotine addiction. It's much more effective when you actually go cold turkey and quit altogether. And that's, how you have a successful outcome. So we've been doing that for years. We had a vision of substance use management when we started, but we also recognize that, this is way back before COVID. Like nobody knew virtual care was a thing. No one knew whether or not it would work. Like the idea of overcoming an addiction without actually interacting with providers in person was a bit sort of out there as an idea, which sounds crazy today, but we had to really prove that. So we focused on something that was towards the lower severity end of the spectrum, involved less regulations from a care team perspective. And fundamentally, we proved not just non-inferiority to traditional forms of treatment, but we could actually significantly improve on the traditional approach with the virtual care model. Over the years, we added, full spectrum alcohol use disorder, opioid use disorders, co-occurring anxiety and mental illnesses as well. And what we realized was that the biggest barrier that we faced was, actually the stigma, and often the fact that people had tried to sort of quit, as it were, or overcome their addiction before, but they had failed or they hadn't been successful. And they almost correlated our name with another attempt of lack of success almost.
Okay.
And it's not lost on us that while our program was called Quit Genius, we didn't actually stand for always quitting, because it was really about empowering individuals to achieve their personal goals. Sometimes that is to quit, but sometimes it's to find balance and cut back.
So the word itself was sort of conjuring up this stigma that you didn't want. So it really was a significant sort of barrier to you.
Exactly. Yeah. And then, clients as well sort of identified us because of that name as a tobacco cessation program, but we had already helped thousands of people overcome alcohol, misuse as well. So we went through this entire strategic process of speaking to our clients, speaking to our members, and understanding, what they really enjoyed from Quit Genius, but also what they wanted to get from the program. And that's where through that branding exercise, the name Pelago came to us. It's actually rooted in the term archipelago, which refers to a string of islands scattered across the sea. And what we found was there was this constant theme of loneliness and feeling like you're an island that our members were really struggling with. Whereas we believe that nobody is truly an island, and we wanted to metaphorically deliver a sea of support to our members. And as we connected the themes together, it became pretty clear that actually this archipelago theme was a great metaphor for what we're trying to do. And Pelago was that invented term that best described it. And it's been super well received. I would say going beyond just the name, it's really the entire brand that's around sort of offsetting a sense of loneliness that our members feel. But from a client perspective, really reinforcing that, we stand for substance use management from that full spectrum, from prevention through to treatment across multiple substances. And on both of those sort of areas, we found the new brand has really found a fit with our clients and members.
Anything that you would do differently about the rebrand itself besides spend more than 5 minutes on the first idea?
It's a great question. I think, I will say that I think our team, in spite of me rather than because of me, executed on the rebrand incredibly well, with reasonably scarce resources. In many ways, it's sort of an argument that we could have done this so much earlier. But when you get to our sense of scale and size, where, you have so many members, you have hundreds of clients, you have channel partners, health plans, you have this B2B2C model, I would actually say not rushing the process. We found to be, very important, taking a methodical approach, because ultimately you don't want to be changing the name, on a particularly regular basis. But, for us, I think the name was the change in brand was an opportunity for reinvention. This is something that I spend a lot of time talking to our employees about, because, things change, and it's really important, I feel, for startups as well as larger organizations to feel comfortable reinventing themselves in the face of a changing environment. And this really fit into the theme of reinvention.
Got it. Let's shift gears a little bit away from sort of the warm and fuzzy of a new brand to the challenges of addiction, particularly in your U.S. market. It feels like this ballooning problem is just getting bigger. And I wonder if you could just sort of comment on the state of addiction in the U.S. and maybe what makes it a uniquely challenging environment here in the United States.
It's a great question. And just a week ago, we released our first annual trends report for substance use management. And it really, it really highlighted a few key themes about substance use disorder and the challenges that, employers, payers, providers, and then individuals, most of all, are facing today. And there were a few that really stood out that, I can comment on over here. We spend a lot of time thinking about our members. But what we often don't spend time thinking about is the impact that substance use has on their family as well. What we found is, somewhere in the region of 1 in 5 individuals will have a substance use disorder of some kind. However, almost half of the population, 46% of American workers today, are actually grappling with the ill effects of substance use when you also include a family member or a dependent. And so often we forget that this is really like a family challenge. Anybody that's been through this challenge will know firsthand that if you have a spouse, if you have a child, if you have a parent going through this, this really affects you. And it's important to really, recognize that as an employer and see how you can go beyond just serving your employees. And this came through in our stats. 46% of American workers were concerned about substance use, either personally or with their family. When you actually sort of dug a little bit deeper, 30% of individuals were specifically missing work because of family members' problems with substance use or alcohol misuse. And then the other thing that's really highlighted is that the stigma is real. And typically the way employers have made benefits decisions over what's covered in their health plans has been what sort of individuals ask for. But what we found was that only about 7% of individuals actually feel comfortable bringing this up as an issue with their employer. And as a result, while 2/3 of employers, 2/3 of employees, want a substance use benefit of some kind, only about 17% actually have that. And that sort of divide, that mismatch between what employees are asking for and what they're actually getting, often, again, comes down to stigma and some of the barriers that exist to accessing care. So I think there's been like quite a few of these trends where it's reinforced what we know to be true, that stigma is a real issue, that that access is a real issue. And the cost also has a significant implication to families.
You talked a bit ago about the power of going upstream and starting to address some of these issues before they become a total crisis, before they explode, and catching somebody early. How do you do that? How do you engage with folks? Let's say you're working with a big employer and there's a whole body of people who are sort of thinking in their minds, like, maybe I'm developing a habit here. I've gone beyond my normal use of whatever substance, drinking, smoking, and there's a habit here. And in the back of my mind, I know I'm heading towards an issue, and I could be susceptible to a program that would head it off. But it's going to take the right hook. So how do you grab those people? You mentioned gamifying the process. What are some of your strategies for engagement?
Yeah, so it's a great question. What I will say is we typically find that an individual falls into different buckets almost. So around 10 to 15% of individuals, with a substance use disorder are actually actively seeking treatment. And you can typically identify that population through sophisticated, clinical targeting strategies that looks at claims data, looks at pattern recognizing different types of claims data, applies AI and machine learning to sort of build that persona almost and then target them. But the reality is for the majority of people with a substance use disorder, about 50 to 60%, they're not seeking treatment today. So it really comes down to awareness building. And this is where us being a provider, partnering with payers and employers to go upstream is really valuable, because we're not just an end provider in the network of a health plan. We're actually a strategic partner to our clients, where we're able to, through a multi-channel process of just awareness manager training, webinars, general sort of awareness around things like mental health, Awareness Week, for instance, or Dry January, able to run campaigns that are focused on helping employees and individuals just better understand their substance use, their relationship with different types of substance. How much am I drinking compared to my peers? What impact is that having on my sleep, the quality of my relationships, other areas of my life? Do I have a problem in the first place? So we help, through those multi-channel awareness processes, to basically just provide better education within our clients. And then from there, we typically, if people are eligible and they meet some of the criteria for our program of being at risk, if not having a substance use disorder, we'll complete a multi-dimensional assessment where they will then, we'll be able to see where they are on the continuum, what comorbidities they have, what their social determinants look like. And then we enroll them into our program, where we're able to deliver a very personalized care plan that's based on the acuity level that they have, knowing that they might be at different areas of the care continuum.
Have you been able to measure success in terms of your ability to reach people who are lower acuity, who are upstream, who haven't yet had a crisis?
It's a great question. And I would say that we found there's no silver bullet there. And when we first launched our wider substance use disorder program, we were indexing, like the clinical targeting piece was almost easier. We were indexing towards people who are towards the more, moderate to severe end of the care continuum. Over time, we've developed a core competency of working, with our internal teams to develop positioning and messaging that actually resonates with people earlier in their journey. And what we realized is that you almost don't want to mention substance misuse, addiction, substance use disorders, because these people often don't identify as having a condition or think like that. It's all about stigma reducing language. Just let's revisit your relationship with alcohol. What does that potentially look like? Yeah. So as we've refined that messaging, and as we've used other techniques like contingency management, we're actually able to go so much further upstream and identify people who themselves, until they speak to one of our care team members, didn't even realize that they had a problem in the first place. They didn't realize that their poor sleep or the deteriorating quality of their relationship was linked to their excess substance consumption. So I think over there, it really comes down to just, recognizing that there's real stigma over here, recognizing that, this is an area that is really affecting people in a pretty deep way. And you don't want to do things that might alienate them potentially, or use stigma-reducing language that might put them off.
Yeah, that makes a lot of sense. I bet you've been exposed to some really inspiring stories of folks who've come through your program. I wonder if there's any that sort of stick with you and kind of keep you going when it's a tough day.
Yeah, I mean, the great thing about being this mission-driven organization and being surrounded by mission-driven colleagues is that there's almost this regular feedback loop of like inspiring stories. I mean, running a startup, you sort of, you interview a lot of people. It's incredibly difficult, and it can be a struggle at times. And this is where I think you have the edge when you're working on a very hard problem, like trying to change society's perceptions and approach to treating this really challenging condition. And then B, you're having a positive impact that at the end of the day makes it feel like it's worth it. And, the great thing about sort of what we do is we have this steady stream of stories and testimonials and like emails and feedbacks of pieces that we get from our members that are super rewarding. I would say that there's one that was shared in our all hands fairly recently that was a really inspiring story. And it was it was a story that we very commonly see. So this was Michael. He's a salesperson at one of our large manufacturing clients. He struggled with alcohol for more than 10 years. It was a problem before COVID, but as with, many of these conditions, COVID made it so much worse because he started to work more remotely. He was able to work at home. He felt isolated from his peers. He didn't see them as frequently. And then he turned to, increased drinking as a coping mechanism. Again, crucially, he knew that this wasn't healthy, but he didn't attempt to seek help because the idea of going to rehab and putting a label on it, was quite scary. And then, he learned about Quit Genius, about Quit Genius at the time, Pelago today, through education and awareness piece we did with his employer. And he thought, this is pretty low barrier, low friction to sign up. I don't need to go anywhere. He signed up to the program. When we interviewed him about a month ago, he was 192 days alcohol free, completely abstinent. He spoke about the way it had just totally changed his life. It affected his anxiety. He thought he had an anxiety problem versus a drinking problem. In many ways, it's affected his sleep. He's more productive at work. He's not missing days anymore. And it's changed his relationships with his family as well. The thing is it's one of those stories that it's easy to get lost amongst sort of, the thousands of people going through the program and sort of the impact we're having, the technology we're working on. But I think it really brings home that, at the end of the day, we're missionaries. We're really trying to have a positive impact on the world. That if we help just one person, it's rewarding. And hearing that story come through was great for the team because he actually sent a video testimonial. So, you could see him almost tearing up as he spoke about his experiences, which was just amazing to see.
I love it. Oh, that's a great note to end on. Just tell us what you are most excited about for the rest of 2023.
I would probably say it's just, being able to realize our impact. I think digital health companies have gone through a really roller coaster few years. It went from super trendy post-COVID to, challenges with the macroeconomic headwinds that, all founders have had to grapple with. But, what I'm seeing as I speak to other founders, speak to our team is we're building great things. We're having an impact. Being able to see the impact we're having tangibly take a hold through the members that we're positively affecting, I think really brings that full circle. And for my advice generally to founders is if you sort of, just focus on the next step and you focus on, the positive impact, then, that's kind of the most, rewarding part of the job. And, most other things take care of themselves as long as, you take an intentional enough approach. So I think for us, it's just how can we scale our impact this year? How can we get our service to more people? We haven't seen that slow down in demand. And if anything, we've seen the need for what we do is bigger than ever before.
I love it. Yusuf, thank you for taking the time with me. It has been very exciting to see you grow, raise funds, scale up, now rebrand to Pelago. I love the rebrand. It's beautiful. It's meaningful. And it's been great to hear your story today. So thank you, and I wish you the best.
Thanks so much, Logan. Appreciate it.
All right. Be well.
Thanks for listening to StartUp Heatlh Now. We'll be back again with another episode next week.